Okay, here we are at the Hotze Health and Wellness Center, specifically Hotze Beauty, which is our aesthetics department. And we're here with Bailey. Bailey, say hello.
Hi!
Bailey is our expert esthetician, and our first treatment that we are going to do a live demonstration of with our beautiful model is a BBL.
Can I tell you who you are?
She's
Okay. So
Tell us a little bit about a BBL.
Okay. BBL is a broadband light treatment. This is considered a photofacial, photo rejuvenation. So what we treat with BBL is hyperpigmentation, brown spots. So any photo damage that the UV or environment has on our skin, that's what we're treating with BBL. And we can also treat facial vascularity, the little vessels around our nose, on our cheeks and chin, and rosacea. But the best part about BBL as opposed to IPL is that it's such an advanced, much more advanced technology that we can also change that genetic expression and rejuvenate our skin and stimulate collagen production and treat the fine lines and wrinkles. So the more BBL you do, the further back in time your cells go. So this is Debbie's first BBL treatment. She has concerns, she's got some sun damage, some very evident sunspots. So what I'm looking for in this treatment is to treat that underlying inflammation, that deeper pigment, and then I will change my filter out because with broadband light you have multiple filters that you can use to treat the skin. And then we'll treat that superficial pigment. So by the time she makes it down to you guys, I would like for there to be some darkening of the spots already. So, can I get started?
Yes,
Okay.
Absolutely.
Debbie, I'm going to test pulse the BBL right next to the right side of your face so that you can experience the light and not be surprised. So broadband light is visible wavelength, so you can see the light. So I always like to give our guests a little warning, so I will pulse. 1, 2, 3, pulse. I will also put my safety goggles on.
Mm-hmm.
Not just those. Okay.
So let's talk about that. How come we're wearing safety goggles?
This is a visible wavelength, so we wouldn't want to flash this into anyone's eyes. Can't see. As your eyes are open, we don't want to cause any damage to the eye area.
Okay, great.
Yeah. She will still see somewhat of a bright light as we're treating.
Great.
Okay. All set? Ready? Ready? Okay, I will start with your neck. Down here, do you feel how the handpiece is pulled? Yes, okay. So I'll do 3 test pulses here, okay? 1, 2, 3, pulse. 1, 2, 3, pulse. 1, 2, 3, pulse. How's that? It cools immediately, so it feels like a warm snap on the skin. It's not uncomfortable, it's not painful. It feels quite nice.
And you don't even have to numb for this treatment,
and you don't
right?
numb for this treatment, no. I just want to make sure that her skin is not responding to the heat in a way that I need to adjust my settings. So if we are good to go here in a few seconds, I will just...
And the gel that our model has on her skin is really gel for the device. There is really no numbing that needs to happen, and this treatment is really terrific for texture, as Bailey said earlier. And I'm just going to get a little closer because one of the things that Bailey talked about was getting at those brown spots and the sun damage, and you'll be able to see as Bailey continues to do this treatment that some of those brown spots, as she said, will start coming up immediately, and then over the next couple of days they'll come up even more so that we get rid of that sun damage.
When we're treating hyperpigmentation or sun damage, most of the time we will notice that darkening. It almost looks like little pepper flakes or coffee grinds on the skin immediately with your first treatment. That's what we're looking for. But a true corrective regimen with BBL is typically 3 to 5 treatments. We would do these treatments every 4 weeks until we clear all of that superficial pigment. BBL BBL will also help to speed up some of that deeper pigment and get that up to the surface a lot quicker so that we can continue to remove it. And remember, it takes years and years and years, decades for sun damage to surface. So what you're seeing now is really a result from many, many years ago.
And Bailey, with this treatment and with multiple treatments, you'll be able to correct that 100%, right? We'll be able to make sure that she doesn't have any of those spots.
I never like to guarantee a 100% because there's pigment that is deeper in our skin than the pigment that we see. Sometimes we do need to introduce a separate treatment that we can stack with the BBL in order to lift that deeper pigment. We will never not be in the sun, so you will always
Good point.
see new pigment that was already there surfacing.
And so when you do a consultation with someone, you're going to analyze their skin and
Yes.
you're going to recommend whether it's just BBL or whether it's stacked treatments.
So depending upon what your expectations are, how much you want to correct in a certain period of time will guide me to giving you the best recommendation that I can. It doesn't happen overnight. Pigment didn't happen overnight, so correcting it won't happen overnight, but just depending upon how quickly you want the pigment gone, how deep the pigment is. We may need to use skincare topically to pre-treat the skin, calm down your melanocytes.
So talking about that sun damage, I know that one of the things you always tell us here at our center is never, ever leave our homes without our sunscreen.
Sunscreen. If you can't wear sunscreen, I can't help you. Okay, let me take a look here. How are you feeling? Okay, perfect. So I treated her skin with one of my deeper filters for broadband light. What I'm going to do now is change my filter and work as superficially as we can to get the brown spots that we can see visibly. Yeah, I'm just going to change everything, okay? This will feel a little different and sound a little different. Minimal discomfort.
And what you're changing now is the wavelengths that you're using?
Yes, chin up to the sky. Here's the chest on the side. Okay. Sounds a little okay.
Now, when we were downstairs talking about the treatments before this, we went live, we were talking about BBL also being able to help with the lack of elasticity in our skin. So would
Yes.
you recommend BBL for that as well?
Well, yes, BBL is a treatment that you can use for rejuvenation and tightening of the skin, treatment of fine lines, pore size, texture, everything. It is a no downtime treatment because it is broadband light. This is nothing ablative. That is something that I would recommend anyone. If anyone has skin, anyone can benefit from a BBL about every 3 months. It's not something that you have to have done all the time. Even if you have one done, it doesn't mean that you have to continue to have more. But you will gradually see a change within your skin over 30 days post BBL treatment. So this is the sneaky treatment that you can have done, and your skin will gradually change, very progressive. No one will be able to tell what you're having done. Because you've not been, out of commission, because you've had no downtime. You can have this done on your lunch hour. You can have this done first thing in the morning, take on the rest of the day. Your skin feels light, bright, and tight when you're finished with the BBL. Now, if we are treating something vascular like rosacea, you can experience some downtime with that treatment because we are using more heat.
So there may be a little redness afterwards.
The redness that you have is a bit exacerbated, and you can experience some puffiness to mild swelling after rosacea, but very, very worth it. This is the #1 treatment for rosacea. More so than topical skincare.
And I know that many of our guests who are men will come in for texture and those large pores that are typical on a man's face, right?
Yes.
And so we've had some really nice success with that,
Yes.
with BBL.
BBL. Men can thank their testosterone for that. That hormone is responsible for the swelling within the inner lining of our pores, and that's why men, or typically more men, will have enlarged pores and are in protection than women.
And as we were saying before, if it's not a treatment for rosacea, for women who like to make sure that after our treatment we can get our makeup back on, there's no issue with that,
You
right?
can put makeup on immediately after a BBL. When my guests come in and have their BBLs done, we will put a calming, soothing, hydrating, firming treatment on immediately after a BBL, and then I will put a tinted sunscreen on as well.
Okay, so let's ask our model, how are you feeling?
It's just fine. I'm as relaxed as can be.
Wonderful. And that's what the beauty of this treatment is that you don't have to numb, you really can. You can see how relaxed our model is. She is having the treatment, she's really doing wonderful things for her skin and for her beauty regimen, but yet it is not something that's painful, and after she's done, she can put that makeup back on and look as beautiful as she always does, even though you look so beautiful now as well.
You say the nicest thing.
Only true.
So what I'm
Okay, so
changing
now I
on
change
the BBL handpiece are my spot sizes. That's another perk with broadband light, is that we can switch our spot sizes and really focus on one particular sunspot and put a more efficient amount of energy into just that one sunspot, and we're not risking the health of the surrounding tissue. We're not causing any excess inflammation. So I am using another spot size on you, Debbie. I am just going to change my settings and just zone in and just hit all these little bitty browns, and then we'll be finished. Yes. Very customizable treatment. Every treatment, BBL and Halo, are both customizable treatment. This won't feel any different. Okay.
So now you're just getting a little bit more tailored with the treatment. Okay.
The energy, the heat that we're sending into the skin is looking for the pigment. So with this spot size, I'm able to hone in on just the pigmented areas for more therapy.
So the great thing about it, as you said earlier, is the treatment's almost done. So if someone did want to come over on their lunch hour or right after they took the kids to school. It's easy for them to get that done and still go about all of their errands for the day.
I go too fast if you
Tells you to slow down.
Slow down. I am going to treat your chin for some of the vascularity. We've got some visible vessels on her chin, none around your nose, lucky you. So I am going to switch out my filter, treat that, and all that.
And those are those fine red veins that,
Little red squigglies, the little broken capillaries that we usually see around here, on our chin, high cheek. And we'll tell them where to go. This feels a bit different than when we're treating pigment, but I have a very small spot size, so it's very targeted deep. You'll just feel a bit more deep, okay? Sometimes we're lucky enough and they'll go away immediately.
immediately just disappear before your eyes.
Just like that. So you may notice over the next few days, this area here will start to appear less red, have a less purple hue.
And so the aftercare for this treatment,
Sunscreen.
sunscreen. Your
Sunscreen,
favorite word.
Typically, my favorite word. Typically, hyperpigmentation, sun damage, browns in the skin is what we're treating. We're trying to correct with BBL. So if that's the case, vitamin C, potent antioxidant protection during the day. Vitamin C fights free radical damage that is causing all of our aging, not just brown spots, all of the aging. So vitamin C during the day, sunscreen, and nighttime treatments just depending upon your skin type.
Mhm.
Typically some sort of a retinoid at nighttime.
And you will guide our guests through that.
Oh yes, oh yes. Okay, I'm going to remove your gel.
Okay. So this treatment is now finished. The gel comes off and we will be ready to do our next treatment. And I can see that the brown spots did come up a little bit more even right after this treatment. So that's great. That's what you want to see,
Right
right?
now they don't look a darker brown, but what they do look a pink purple hue.
Mhm.
Okay. Miss Debbie, thank you for allowing me to treat your skin today. And I will see you bright early tomorrow morning to make sure that you have your sunscreen on. Right. Right.
And she will absolutely follow up on
Don't
that.
forget to reapply. Yes, ma'am. Okay,
Good,
you
wonderful.
are free to go.
Great.
I do. Here we go. I got it.
And I'm just going to show everyone, this will be one of our next treatments, which is our hydrofacial machine. That will be our third treatment. And the machine that we're using for the BBL and the Halo, right?
Yes.
Is our
It's
Cytot
BBL and
machine.
Halo.
And we can see the Halo device right there. And the machine is called Cyton, and it is a state-of-the-art laser treatment machine that we have here, because not all machines are equal.